Aloe vera is beneficial for the digestive system, aiding in cleaning and promoting bowel movement, thus preventing constipation. Aloe vera juice aids weight loss by cleansing the body, maintaining a full stomach, preventing excessive calorie intake, and boosting metabolism, thereby burning fat. Aloe vera juice, consumed on an empty stomach, aids in detoxifying the body by removing toxins and cleansing the digestive system. Aloe vera, commonly used as a topical medication, has a long history of treating sores and burns, including sunburn, and is effective for first and second-degree burns. Aloe vera treatment has been proven to expedite the healing process of mouth ulcers or canker sores by reducing pain and accelerating the healing process. Using aloe vera gel to coat fruits and vegetables extends shelf life by inhibiting fungus and bacteria growth, thus preventing spoilage. Aloe vera gel and juice may lower fasting blood sugar levels in type 2 diabetes patients, improving blood sugar and fatty acid levels, and potentially reducing the risk of complications, especially in those with prediabetes or type 2 diabetes. Aloe vera latex, a sticky yellow residue beneath the leaf skin, contains aloin or barberline, a laxative compound that aids in treating constipation. Aloe vera syrup has been shown to reduce symptoms of gastroesophageal reflux disease, making it an effective treatment for gastrointestinal disorders. Aloe vera significantly reduces itchiness, scaliness, and affected area size in individuals with seborrheic dermatitis, a skin condition causing temporary hair loss. Aloe vera gel may slow skin aging, increase collagen production, improve skin elasticity, retain moisture, and enhance skin integrity, potentially benefiting dry skin conditions.